would like to extend a warm welcome to our esteemed faculty and distinguished dignitaries. Honorable Vice Chancellor, DMIHER, Dr. Lalit Bhushan Bhatmare sir, Honorable Registrar, DMIHER, Dr. Shweta Pisulkarla, Honorable Executive Director, Academic Executive, Dr. Tripti Bhatmare, respected Dean Jnmc, Dr. Abhay Gayatri sir, respected Dean Academics, and Head Department of Physiology, Jnmc, Dr. Alka Ravekar ma'am, respected Director, Student Welfare, and Professor Biochemistry, Dr. Ashish Anjandar sir, respected President, Academy of Physiology, India, Dr. Anurna sir, Professor Physiology, AIMS Nagpur, respected HOD Physiology, Jnmc, Dr. Shubha Bode ma'am, your presence here adds immense value to this occasion. To mark the beginning of today's celebration, we will now proceed with the lamp lighting ceremony. This is a symbolic gesture to light the way for knowledge, unity, and success. I invite all our respected guests to come forward and join us in this beautiful tradition.
मैंने एक बार फोन कर दिया
Hello. So on behalf of the university, I welcome all the participants who have come from outside the campus as well as the internal participants for today's physiology quiz. May the best team win, and you should try your best to win today's quiz. I also welcome all the faculty members who have come, traveled from various places and tried to visit us. I would also want all the team members, once they are through with their quiz, they should visit our museum and skills lab and give us suggestions as to what all things should be included in that skills lab and museum. All right, and that will carry special marks from my side. Those who give 10 best suggestions would win some gifts other than the quiz. Okay, so all the students who are sitting across, we should try and support each team, not only Jnmc team. We are the host, so we should be welcoming to everybody. Of course, Jnmc team is important. Jnmc team all the best, but at the same time, other teams are also our kids only. So you don't be a hostile audience. You know, if there is a IPL match on Chennai, Chepauk Stadium, how many of you have seen any IPL matches? All of you. Chepauk Stadium, if you go and if you support any other team other than Chennai Super Kings, you are a dead man there. But if you watch the same match on Boxing Day at Sydney Cricket Ground, they will appreciate a good six by Nitish Reddy, who is unknown to them. They will also appreciate Rohit Sharma's cover drive or hook. So we should also be the audience like the audience which is there in the Sydney Cricket Ground. Okay, appreciate good work done by all the teams. All the best to all of you. I congratulate Department of Physiology for organizing this event. And again, may the best team win. All the best. Thank you.
Thank you so much, sir, for your insightful opening remarks. We are truly excited for the day ahead. Now I invite Dr. Alka Ravukar ma'am to announce the selected six teams. So good afternoon, one and all the respected teachers, Dean Jnmc, Dr. Abhay sir, HOD Biochemistry, Dr. Archana, Dr. Krishna, Dr. Shweta, Dr. Anaka, and all the faculty members, and my dear students. I think 23 batch and 24 batch, both batches are here. Basically, this quiz is organized for the students who are nearly cracked the NEET. And it's based on that. It is not just cracking your second MBBS or final MBBS partner. So the main aim was that you should be aware about the importance of physiology, how it is connected to clinical, and how the questions are important for your NEET examination, PG examination. And based on that, we have organized this event. Today we have 10 teams from Jnmc, IIT Nagpur, AIMS Nagpur, Wardha College Amravati, PDMC Amravati, NJM Sevagram, JMC Nagpur, DMMC Nagpur, NTB Sarve Nagpur, and DMC Yavatmal. So total 10 colleges were represented, and out of that now I will announce. We had a screening round for all these 10 teams, and out of that 6 teams are selected. I will announce one out one by one, and the participants from that college should come on here and they will take their seat. The first was AIMS Nagpur. Please come on the stage. GMC Nagpur. NJM Sevagram. IGDMC Nagpur. JNMC Savangi. And Wardha College. All the 6 teams, congratulations for getting selected for this round. Please, and now just take one seat. This is just allotment of these tables. So we have 6 tables. Team Edison, Team Bernard, Team Bajaj.
So AIMS Nagpur has gotten Tia Gallon.
Gallon. Second. How कोई भी आओ. कोई भी आओ.
Team GMC has got Nagpur has got Tia Alden.
देखो यहाँ पे Alden. Third,
MGMS Sevagram has got team Kajal.
fourth,
IGATMC
Bernard,
got Bernard. Team JNMC got Sean. And Wardha has got Team Addison. Let's give a big round of applause for the challenging teams ahead. Before the break, we saw some strong team selections with a lot of promising talent over across the board. But now the real fun begins. We are about to start some interesting and intense rounds, so I hope everyone is feeling sharp and ready to tackle the question ahead. Stay focused and may the best team win. Now I invite to guide us through the quiz. I would like to introduce our quiz master. Our quiz master today is not just a master of questions, but a true conductor of this intellectual symphony. She'll keep you on the edge of your seats, challenging your minds while ensuring this quiz is as fun as it is competitive. Please give a big round of applause. Welcome to Dr. Vaishali Konikar ma'am, Professor of Department of Physiology.
Very good afternoon, everyone. Once again, I would welcome our respected dignitaries, all the faculties who are present here, all the dear participants, and my dear students of the 23 and 24 batch MBBS. So, are you all excited for the quiz? Yes. I want to hear a big yes. Yes. Okay. So, all the best to all our participants. All the best. Now we start with the quiz. Let me take you through the rules of the quiz. So there are marks for every round which are variable. Every round has got its own time limit and the quiz master's decision will be final. Now there would be some ground rules for the audience also. For the smooth conduction of this quiz, for an unbiased thing, I would request all of you not to prompt. Okay, you can discuss amongst yourselves and we would also have an audience round. So where you will be given a chance to answer the questions and you would also be given some exciting gifts. Okay, so let us start with the quiz now. So our teams, as they've already been introduced, Team Allison, Team Bernard, Team Kajal, Team Janet, Team Harvey and Team Schwab. Now the rounds, so there are going to be 8 rounds. First round is the basic physiology round, then we have the applied physiology, clinical images round, fourth is the missing link, fifth one is the reagent sequence, then we have the crossword, the mixed bag and rapid fire. So as I take you through the rounds, we will go on talking about the rules of the round. Right. So the first round, that is basic physiology round. So are you all ready? Are you all ready? Yes? Okay. So basic physiology round. Now this is just like a warm-up. So there will be very few basic questions over here and it will be executed. Okay? So shall we start? Let us talk about the rules of each round. There will be 2 rounds in this. So in total there will be 12 questions. So every team will get 1 question per round per team. Is that clear to you all? Yes? Each question carries 10 marks. After the question is read, the participants will get 1 minute to answer the question. There is no negative marking and no passing question. Right? So let us start. Next. So we'll start with Team Allison. Okay? All of the following are true regarding red muscle fibers except the options are A. Contain more mitochondria, B. Exhibit high glycolytic metabolism, C. Is contain more myoglobin, and D. Is have more oxidative capacity. So now you get 1 minute. A timer starts. Yes. Use the mic. The teams says option A. So let us see the right answer. So the answer is B, right? So there will be no marks for us. Okay. Next. Yes, this is for Team Burner. Which of the following serve as anchoring junctions between cell and basal lamina? Right? So it is tight junctions, desmosomes, gap junctions, heavy resonance. Option A, tight junctions. Let's see the answer. So the answer is option B, heavy resonance. Okay? So again, there will be no marks for this. Next. So Team Kajal. Yes. Can we have the next question, please? Normal atrioventricular delay of zero point 0.1 seconds is due to decrease in the amplitude of firing, resistance offered by myocytes. Option C is decrease in number of gap junctions, and D, lack of tight junctions. So this is for the team. Yes, Sajad. Use your mic to answer the question. Yes. Answer C. Yes. Let us have the answer. It's the right answer. Very good. So we get 10 marks for this. Next question is for Team Gallon. Which of the following is not a function of insulin? Okay, which of the following is not a function of insulin? Glycogen synthesis, B, glycolysis, C, ketogenesis, and D, lipogenesis.
Option C, ketogenesis.
Very good. Yes, so let's have the answer. So this is the right answer. Option C, ketogenesis. 10 marks for Team Gallon. Now Team Harding. The arteriovenous difference in stagnant hypoxia is A, normal, B, increased, C, nil, and D, decreased.
Option B.
Yes. Let us have the answer. Right, this is the correct answer. So 10 marks for Team Harding. Next, Team Swan. Ovaries produce all of the following except gonadotropin, progesterone, estrogen, inhibin. Yes?
Option A, gonadotropin.
Right. So, can we have the answer? Yes. That's the correct answer. Now we have one more round. Right? So the next question is again for Team Addison. In infants, defecation follows a meal. It often follows a meal. The cause of colonic contractions in this situation is its increased circulating levels of gastrin, B, gastrocolic reflex, C, increased circulating levels of cholecystokinin, and D, enterogastric reflex. So which one of these is correct? Please use your mind.
Option B, gastrocolic reflex.
Right. So the option B, gastrocolic reflex, is the right answer. 10 marks again. Next, Team Burner. ACE stereognosis is associated with lesion of which of the following tracts? Is it A, anterior spinothalamic tract, B, dorsal column tract, C, lateral spinothalamic tract, or D, lateral corticospinal tract? Right. So let us see the answer. They say option B, dorsal column graft. That's the right answer. Very good. Next. Super team Sajal. Which of the proteins, following proteins is present in tight junctions? A. Elastin. B. Albumin. C. Claudin. D. Globulin. Okay, let's see the answer. Yes, that's the right answer. So C. Claudin. 10 marks again for team Sajal. Next, team Gallon. When the tension developed in the muscle is greater than the load and the load is lifted, this type of contraction that occurs is called as isometric, isotonic. C is eccentric contraction, D is Mendelic reaction. So what is the answer?
Isotonic.
Yes, so let's see the answer. Good. So your answer is isotonic. 10 marks here. Next, team Harvey. The circulating blood does not clot owing to all the following reasons except A. Its velocity, B. Presence of layer of glycocalyx lining the endothelium, C. Its circulatory anticoagulants like protein C and S, and D. Presence of thrombin fibrinogen complex.
Option 4, presence of thrombin and factor.
Yes. Right. What should it be? Why is it wrong? It should have been presence of. Okay. So next, it should be thrombin antithrombic complex. Yes. Team Swan. Team Swan. In a 100-meter sprint, most of the energy consumption by skeletal muscles to replenish ATP is derived from A. Phosphocreatine, B. Aerobic glycolysis, C. Oxidation of fatty acids, D. None of the above.
Option A for
Yes. Let's see the answer. So this is the right answer. A. Phosphocreatine. Good. So now we quickly have, after the break, we have round 2. Yes. So before that, let us have the audience now. Now this is for the audience. A very simple question. A very simple question which I think my son also answered yesterday. So let us see. Please thought he could answer this question. Which of the following has the greatest effect on ability of blood to transport oxygen? Option A, capacity of blood to dissolve oxygen. B is amount of hemoglobin in blood. C is the pH of plasma. And D, CO2 content of RBCs. Who's going to answer? I want someone having 24 backs to answer. 24 backs. Yes? Yes? Pass on the mic. Right. So option B, that is amount of hemoglobin in blood is the one which determines the ability of blood to transport oxygen at the most. Yes, good. Prize has already been given. Yes. You got the prize? Good. Right. So now we move to the second round. a well will be done when half the time is over. So you get an idea of that half the time is limited. So for example, if you have a 1 minute time to answer the question, at 30 seconds you ring the bell, you get an idea, another 30 seconds to ring. And if it is 30 seconds, you get 15 seconds to bell will be done. Is that clear to you all? Okay. So let us move to the second round, that is applied physiology. Now we'll go to a little bit complex one. So applied physiology. Now let us see the rules of this. One round with one question for each team. Right? So this will not be 2 rounds, it will be 1 round, one question each team. Each question carries 10 marks. After the question is read, participants will get again another 1 minute to answer the question. No negative marking, no marking. So the rules remain the same like that of the first round. Okay? Let us start. So the question goes to team Addison. You carefully listen. Okay? And you have to give the diagnosis. Now, an intensivist is assessing an electrocardiogram within strip. The P waves and QRS complexes are regular. The PR interval is 0.16 seconds and QRS complexes are measured 0.08 seconds. The heart rate is 64 beats per minute. You need to interpret the rate. Team medicine, the time starts now. You have another 30 seconds left. Yes. So is it right? Can I have someone from the audience answering this question? 23 batch. Because I think ECG is not over for the 24 batch. Right? So anybody from 23 batch? Anyone? None of you? Come on. None of you? मुझे लेना पड़ेगा ECG का भी. Yes? Okay, so shall we have the answer? So it's a normal sinus rhythm. It's a normal sinus rhythm, right? Next. Team Bernard. A 55-year-old female who is a chronic smoker working as a human resource manager at multinational company is admitted in an emergency unit with complaints of difficulty in breathing. She is under insulin therapy since 20 years. Her arterial blood gas and serum electrolyte report findings are sodium 140 milliequivalents per liter, potassium is 3 milliequivalents per liter, chloride 101 milliequivalents per liter, HCO3 bicarbonate is 70 milliequivalents per liter, pH is 7.29 and PaCO2 is 37 mmHg. You need to interpret the primary acid base abnormality in the above case. Your time starts now. Thirty seconds more.
Compensated metabolic acidosis.
Metabolic acidosis. Let's see the answer. So that's the right answer, metabolic acidosis. So this is like a professor of physiology as well as biochemistry, right? Good. So they get 10 marks. Next, with complaints of clumsiness of his right arm since 6 months. He noticed that his right arm had a tremor when he tried to insert a key into a lock. He also noticed that he had a drunken gait. When presented with a target and asked to touch it, his finger tended to overshoot the target. Now you need to identify the neurological structure involved. And your time starts now. Identify the neurological structure involved.
Cerebellum.
So let's see the answer. So this is the cerebellar region, cerebellar disorder, and the neurological structure of the cerebellum. Right, next. Now Team Gallant, a female aged 28 years came with history of nervousness, restlessness, tiredness, excessive sweating, palpitation, increased appetite, and amenorrhea. On examination, there was tachycardia, dizzy on exertion, and fine tremors of hands. Skin was warm and moist. Front of the neck was enlarged. Eyes were prominent. Lips were retracted. Cardiac examination revealed heart was enlarged. There was cancer tachycardia, and following investigations done revealed BMR 40%, serum cholesterol 100 milligram percent, basal pulse rate 120 per minute. So, what other investigations in this case will confirm your diagnosis? Yes. What other investigations should be done in this case to confirm the diagnosis? You have done all the investigations.
Other investigations that have to be done to control the diagnosis are thyroid function test, thyroid profile, TSH, T3, T4, anti-nuclear antibody, and reverse.
Very good, very good, very good. So let us see the answer. So we expected at least serum T3, T4, and TSH has to be balanced. And this was again an overlap between biochemistry and physiology, right? So next, Team Hale, a 65-year-old man who suffered from stroke 2 days ago now presents with involuntary violence and flinging movements of the limb on one side. Now, what is the likely site of lesion in this patient? Yes. Now, you're not able to hear me.
The likely site of lesion is subthalamic nucleus.
Very good, very good. So let us see the answer. So this is hemivaliscus and the likely site of lesion is subthalamic nucleus. Good. Next. Please one. A 35-year-old woman sees a physician to report weakness in the extraocular eye muscles and muscles of the extremities. She states that she feels fine when she gets up in the morning, but the weakness begins soon after she becomes active. The weakness is improved by rest. The physician treats her with a drug that causes immediate return of muscle strength. What is the likely action of drug given by the physician? So once you identify the drug, you can answer what is the likely action of drug given by the physician, and your time has already started.
Anti-acetylcholinesterase,
Sorry?
anti-acetylcholinesterase activity.
Yes. So it's an let us see the answer. Anticholinesterase causes cholinergic effect. So that's the right answer. Again, 10 marks for team Swan. Now let's put the audience now. Yes, audience, are you ready? Okay. Now, a neuroscientist is studying communication between hypothalamus and pituitary in a rat model. She interrupts the secretion of which of the following hormones will be unaffected by this experimental manipulation? The question is, secretion of which of these hormones will be unaffected? Okay? Yes? Loud? Give mic. Yeah, that's right. Vasopressin. Vasopressin, can you name another hormone? Who's, yes? Oxytocin, very good. So these two will be unaffected. Very good. So a big round of applause. I can use the participants from Jnmc or one. Very good. Next. So we will have a break now. Yes. Scores are already calculated. Am I audible? Yes. So team addition, basic physiology round has 10 marks. Burner 10, Sajal 20, Gallon 20, Haldane 10, Swan 20. Yes. Basic physiology के बाद से yes. Okay. Applied physiology, addition 0, Burner 10 marks, Sajal.
Basic physiology, we had both the questions correct.
What were your questions and answers? Right? And the other one was? Subthalamic. What is subthalamic? Okay, so team Haldane gets 20 marks for the basic physiology round 2. So that was missed by our scorers. So it will be 20, please correct it. So these are the scores for the 2 rounds.
मिक्स बैठे ना राम कुमार
Participants, smile, you are being screened right. All of you. Have a happy face and buck up, you're doing well. So a big round of applause for all.
Right, so we are back again with the third round, and this is going to be a clinical images now. So I hope you all are enjoying. Yes, so you'll enjoy further. This is more interesting. The clinical images round. I don't know 23 batch, but 24 batch, but 23 batch should be able to recognize these images. Right. So let us have the first one. Right. So we will have these rules first. There would be again 2 rounds. Okay. Please listen carefully. There will be 2 rounds. One question per round for each team. Each question carries 10 marks. After the question is read, here the participants get only 30 seconds to answer the question. Here the negative marking is applicable. Okay. Negative marking for every wrong answer there will be -5 marks and pass round. And once the question is passed and you answer it right, you will get 5 marks. The next team gets 5 marks. Is that clear to anyone? Are there any doubts? Yes. So let us start. Okay. Negative marking applicable on the past question. And if you answer it wrong, you will get -5. Okay. And if it is passed, you will not get. You will get 0. The next person will get 5 if they answer it correctly. Is that clear? Yes. If that question is wrong, then again there will be a negative marking. Okay? If the person has passed it and that question again is wrong, then you have negative marking. That answer if it is wrong, then there would be a negative marking in there. Okay? So let us have the first question. T medicine. So T medicine. Visual defect caused by lesion at C. You have 30 seconds. Quick. Fifteen seconds. 54 seconds.
Homonymous hemianopia.
Right. So let's see to the answer. But the complete answer was it is right homonymous hemianopia. Okay. So we can mark for this. Next. T Bernard. Any other? Which region at which lobe of the cerebral cortex leads to such a drawing by the affected person? Okay, so this is a drawing made by a person whose one particular lobe is affected. We need to identify that lobe. Cerebral cortical lobe. Very good. So next, let us see the answer. Again, it is the left parietal lobe, and this was the case of constructional abrasion, right? So this was the left parietal lobe region. Again, we will mark to them. So Full mark? Yes. Next. Team Bajaj. Identify this clinical disorder.
Ground sequence.
Yes. Let's see the answer. That's the right answer. Brown Sequard syndrome. Good. Next. Team Gallon. Now, a subject standing at 6 meters distance from given chart, this is a Snellen chart, can read no further than 24 meters line with both the eyes. Then his visual acuity is reported as. So you need to mention the visual acuity of this person.
Three by five.
Yes, let's see the answer. So the visual acuity will be 6 by 24, right? Because what he should have read from 24 meters, he is actually reading it from 6 feet. The answer 3 by 5. So that's a wrong answer. Please note it. You have a negative marking for this, so -5. Yep. Please you have to use your mic. The audience are not able to hear you. Switch on your mic, all of you, while answering the question. Then you will switch it off. Now, team Harding. So identify the phase of endometrial cycle depicted in D. Which phase of endometrial cycle is depicted in this? Few more seconds. So your time.
Frozen steam article.
The question passes to the next team. Yes, team Swan.
Proliferative phase.
Yes, that's the right answer. What pattern is this? What pattern is this? It is the third pattern, which is under the effect of estrogen in the proliferative phase. Very good. So can we have like this team gets 5 marks, right? Next. Now the next question is again for team Swan. Identify the green curve in this. Thirty seconds. Identify the green curve. 15 more seconds.
Rectangular hyperbola.
You need to identify the name of the curve. Okay, is it passed? Is it passed? Then we go to the next team. It passes to the next team. Addition. Okay, myoglobin. Next. That's the wrong answer. Next. -5 for this team. Burner. Are you passed? Can you pass? Are you going to answer this? Okay, next.
Fetal hemoglobin curve.
Next, that's -5. Next team. Okay, so you quit, right? Let's have the answer. So this is the carbon monoxide hemoglobin dissociation curve, which has got a very high affinity for oxygen, right? So this was the answer. Okay? Right. Now, T medicine. Okay, this is 2 rounds, right? So again, we begin with T medicine. You have to watch this carefully. Watch the video. Play the video first. Okay, now mention the disorder in which Be quick. Seconds left. Okay, next team, pass. Next, pass. Very good. Pass. Pass.
Ankle clonus, upper motor neuron
Very
vision.
good. Very good. Therapy.
Phototherapy is convert film.
So like unconjugated bilirubin is converted to what is bilirubin? Photoisomer that gets excreted through urine, and this was phototherapy. Good. A big round of applause for them. Yes, next. Team Sajjan. Now please watch the video carefully first. And you need to mention the neurological defect in which this sign is observed. Mention the neurological defect in which this sign is observed. 30 seconds.
Now it is intentional tremors and staging cerebral lesions.
That's right. Next. So intentional tremor, female cerebral lesion. Team Gallant. Label the neural center of respiration hidden in the blue box. Which neural center of respiration is hidden in that blue box? It's for Team Gallant. Acoustic center. Right. So the answer is acoustic center. Correct. Next, Team Harvey. Now, lactile appearance of esophagus, this is the esophagus, in barium beam X-ray is found in which gastrointestinal disorder? Loud. On the mic.
Achalasia cardia.
Achalasia cardia. Right. Very good. Very good. So, it is achalasia cardia. Next. Now, team Swan. Identify the clinical test. You need to identify the full name for this clinical test.
Ishiyara's test?
No, -5. Okay, so pass. Pass. Next. Pass. Use the mic. Okay, pass. Next.
Holmgren's color rule test.
Very good. So it's a Holmgren dual matching test for testing the color wheel. Right? 5 marks for this team. Gallant. Okay. So that ends our clinical images round. Now, question for the audience. Can we have the question? Very simple one. It is overlapping with anatomy or histology. So identify the hormones depicted by numbers 1, 2, 3 in the given image. Anyone from the audience? Yes? You don't mind? You can stand in your place. Very good. Yes. Very good. So let us have the options. Given this gift. Shubham? Gift. Right? A big round of applause. Yes. Now let's move to the round 4. Now this is a missing link round. See, please two missing links. Listen carefully. There are two missing links. Each question carries a total of 20 marks. 10 marks for each missing link. Okay? Now after the question is read, participants will get again 30 seconds to answer both the missing links. This has to be noted. Both the missing links, 30 seconds. Negative marking is applicable again. And for every wrong response, there will be -5 marks. There will be no passing in this round. Okay? So we'll begin again with team Madison. Right? You get 30 seconds. You have to identify both the missing links. If you identify one missing link, you get 10 marks. For one wrong answer, you will get -5. Is that clear? If you identify both the links, then you will get 20 marks. Okay? So let's start. Identify the missing links in the vasodilator theory below. Okay? Increase in metabolism causes excessive utilization of oxygen. ATP gets converted to ADP, and that leads to increase in dash. Then that again gets one missing link, which decreases the peripheral resistance, and this in turn increases the blood flow. So this is the vasodilator theory for regulation of auto regulation of blood flow. You need to identify these two missing links. 30 seconds. 15 seconds.
ATP converts to ADP, which converts to cyclic AMP.
Next, what is your next? You want to answer only one. So that is the wrong answer, and they get -5 for this. Okay, let us see the right. So increased metabolism causes excessive utilization of oxygen. ATP converts to ADP, ADP to adenosine. Okay, and then that leads to vasodilation, which in turn decreases the peripheral resistance and therefore increases the blood flow. Is that clear? So you get -5 for this, right? Next P burner. You need to find out the missing link in this periodic breathing mechanism. So whenever there is voluntary hyperventilation, CO2 wash out occurs, which decreases the partial pressure of CO2, and this will cause something missing over there, which leads to accumulation of CO2 and increases the CO2 plus a fall in CO2, which via peripheral chemoreceptor will again missing link and in turn lead to hyperventilation. So you need to identify both the missing links. Keep going. Your time starts now. Seconds. The time over. This round is no passing round. So anyone in the audience? Even the faculty can. So anyone from the audience? Students? 23 batch? I was 23 batch, 23 batch man. कोई तो भगवान है CO2 accumulation से क्या होगा? तो decrease in CO2 से क्या होगा? Nobody is even trying. तुम्हारा negative marking नहीं है. You might as well get a 8. नहीं चाहिए बोल रहा है. हाँ नहीं चाहिए मैम. Yes. What is the stimulus for activating or stimulating the respiratory center? अच्छा ठीक है. Okay. Oxygen है, CO2 है कि हाइड्रोजन है? Okay. So you need to read respiratory system. हो गया तुम्हारा तो PCT भी हो गया. Okay. So you will be reading this periodic breathing mechanism, all of you. Let us have the answer. So decrease in CO2 will cause apnea, and apnea causes accumulation of CO2 as well as there's a fall in oxygen concentration, and that's why this stimulates the respiratory center. These are all stimuli for activating the respiratory center, which in turn causes hyperventilation. Is that clear? So this cycle goes on. Now next, team Hazard. Yes. Now complete the following accommodation pathway. Visual information via visual pathway goes to the primary visual area, item number 17. There is a missing link in between, then which via corticonucleus fibers will again go to one particular site, which via the third nerve will cause ciliary muscles, sphincter pupilli and medial rectus contraction.
And second one is Vedica
Second one is Vedica nucleus. Yes. Can you answer the first one? So that's the right answer. And you get half the marks. Anybody? Anybody from the audience? So it is the frontal eye field, area number 8. Okay, and then it goes to the endovascular area. So this was the accommodation pathway, right? 5 marks for this. It's 10. Yes, it's 10 marks for this because we had 20 marks, so 10 marks for each correct missing link. Okay, next, T. Gallen. Can we have 2 questions? Identify the missing link in the brain bridge reflex below. Increase in atrial pressure of venous return will lead to dash, which via afferents to vagus causes something missing. This then via efferents to the vagus, which is inhibiting the vagus and stimulating the sympathetic nerves to the SA node, increases the heart rate. So this is our brain bridge reflex. You need to identify the missing link. Team Gallen.
Seconds. First blank is low pressure receptor, and second blank is vasomotor center.
That's not the low pressure receptor. Let us have the answers. So you have the firing of the atrial stretch receptor. This is a specific thing, okay? Because atrial pressure increases, so the atrial stretch receptors fire, okay? And then vasomotor center we give marks to them. So 10 marks for the vasomotor center, right? So it could be any pulmonary cardiovascular center, right? Either the cardiac inhibitory or the vasomotor center, right? This has to be specific. There are many low pressure receptors, right? That's why you're getting 10 marks for this. Next. Okay, -5 for the first incorrect answer, right? Okay, so next, Team Harding. Simple one. Identify the missing link in the fibrinolytic pathway. Plasminogen activators will stimulate dash, it gets converted to dash, and this in turn will cause fibrin to get converted to soluble fibrin pigments. So what is the missing? 2 missing links over here. Time starts. This will come to the audience. Yes, 15 seconds.
second one is plasmin.
Second one is plasmin, right? So you get 10 marks for this. And okay, time. So let's see. I want the audience to answer this. They said, see, this is the third hint. They said the second one is plasmin. So please answer the precursor for plasmin. Plasminogen, very good. So, yes. So this is the missing link. They get 10 marks for this. Now let us move to the next question. Team Harding. Sorry, Team Schwann. Team Schwann. Right? Identify the missing link in the given flowchart of lactational amenorrhea. Okay? High serum prolactin during breastfeeding will lead to rash, which in turn again a missing link causes anovulation, and this anovulation is responsible for amenorrhea in the nursing women. You need to identify these two missing links. This is the pathophysiology for activation of hormone. Okay, you have 15 seconds. You don't want to answer? Okay. There's no passing over here. Audience? 23 batch. 24 तो सब जाएगी क्योंकि reproductive हुआ नहीं है. So 23 batch. Anybody from 23 batch? What is the cause for lactational amenorrhea? मैम सेट की अभी आंसर नहीं किया तो ऑडियंस को हटा लेंगे. Yes. Okay. So let us have the answer. So there is suppression of the gonadotropin releasing hormone secretion, which in turn suppresses LH. You know that LH hormone is required for ovulation. Ovulation gets suppressed. No amenorrhea in nursing women. So no marks for this one. They have not attended. So 0. Okay. Right. So we have the scores. Shortly we have the scores of these two rounds. Before that, we have the audience round. Audience is not answering anything. So let us have the audience question. Growth hormone regulation. Okay. So hypothalamus का arcuate nucleus secretes something. Okay. Paraventricular nucleus is secreting something, which in turn is stimulating. One of them is stimulating the anterior pituitary somatotrope. The other one is inhibiting it, which in turn causes release of GH, that is growth hormone, and which stimulates the liver to release it, to release again a missing link. I was going to say the answer. So it again a missing link. You need to identify these three missing links. I'll give a hint. First two are hormones. Okay? What are those two hormones? Yes? Shubham? You want to answer the question? Yes? Very good. Can you name the other name for growth hormone, inhibiting hormone? What is it? Very good. So he's answered all the three correctly. He gets one gift showing. Okay? Okay. So next, let us see. Answer. It's GHRH, growth hormone releasing hormone, somatostatin or growth hormone inhibiting hormone, and the other name for somatostatin C is again insulin like growth factor 1. Okay? So very good. A big round of applause for him. Yes. Now we have the scores shortly, and I'll be back for the next round. It's time for the total scores. So team Addison, team Bernard 35, Najal 60, Gallen 40, Alvin 50, and Sean 35. So on the leaderboard we have Kajal. A big round of applause. Right? Till now is Kajal. Right? Next. We have the next. So now this is an interesting one. Arrange in sequence. Okay? Please listen, all the participants. Let us go through the rules. You have to be very alert here. This is a bell round. The team which rings the bell first gets the chance to answer the question. Is that clear? The team, this is a kind of buzzer round. You have to ring the bell. You will get the chance. Whoever rings it first. Each question carries 20 marks. After the question is read, participants get 1 minute to answer the question. Negative marking is applicable here. So if you do not arrange it in sequence, you will have negative marking for every wrong answer or no response after ringing the bell. See, remember this, after ringing the bell, if you don't answer, then also you have a negative marking. So minus 5 marks for that. And there will be no passing of questions. Are the rules clear to all the teams? Okay? So first come, first serve. And you have to quickly answer. If not answered, negative. If answered wrong, negative. Yes. How many questions do you have? We have 6. Okay, so we have 6 questions. And of course, whoever rings the bell will get a chance. Question number 1. So you need to arrange the steps of phagocytosis in order. Immigration and diaphoresis, opsonization, degranulation, chemotaxis, engulfment, degradation. And your time has started. We have 30 seconds. Sorry, 1 minute to answer this question. Yes, Team Gallen. You can answer. Yes. Ask the question first.
First, opsonization, then immigration and diaphoresis, chemotaxis, then engulfment, degranulation and degradation.
Let us have the answer. So first was immigration and diaphoresis, which is the wrong answer, right? Second is chemotaxis, opsonization, engulfment, degranulation, and degradation. So you get minus 5 for this. Okay. Right. have the next question.
Next question.
Arrange the steps of smooth muscle contraction in sequence. Okay. Activation of myosin ATPase, activation of myosin light chain kinase, calcium calmodulin complex, calcium influx from the extracellular fluid, binding of myosin to actin, and phosphorylation of myosin head. Yes, quickly.
First is the calcium influx from the extracellular fluid.
Yes.
And second is the activation of the myosin light chain or calcium calmodulin complex.
Second one is calcium calmodulin complex. Okay.
Activation of the myosin light chain kinase.
Yes.
Then activation of the myosin ATPase. Phosphorylation of the myosin head. And then binding of the myosin.
Let us see the answer. So that's a wrong answer, right? So after activation of myosin light chain kinase, we have phosphorylation of myosin head and then activation of myosin ATPase. Okay. So -5 again, the target. Okay. Next. Number 3. Arrange in sequence the following events as they occur during puberty in females. Menarche, puberty, hilarity, secondary sexual characters. Yes.
Large and Vivace, Menarche, and what the secondary section.
Right, good. Let's see the answer. So that's the right answer. Okay. Next. Question number 4. Arrange in order the steps of thyroid hormone synthesis. Oxidation of iodide into iodine, organification of thyroglobulin, iodide trapping, thyroglobulin synthesis and secretion, secretion of thyroid hormone, coupling reaction. Yes. Okay, so Sean had rung the bell first, it seems. Okay, so we give a chance to Sean. Team Sean.
Ma'am, first there would be iodide trapping, then there would be oxidation of iodide into iodine, then there would be organification of thyroglobulin synthesis, then there would be, thyroglobulin synthesis first. Should I repeat it? Yeah, first would be iodide trapping, then second would be oxidation of iodide, third would be the thyroglobulin synthesis. Then fourth would be the organification. Then fifth would be the coupling reaction, and then would be the secretion.
So that's the right answer. Now, fifth question, please. Question number 5. Arrange the steps of spermatogenesis and sequence. Yes. Quick.
Spermatogonium, primary spermatocyte, secondary
Very simple. Yes. That's the right answer. Now this is the last question. Okay. Arrange the phases of folliculogenesis in ovarian cycle in sequence. Graphic follicle, primordial follicle, primary follicle, preemptive follicle, and tertiary follicle. Team Burn.
Primordial,
Yes.
primary follicle,
Yes.
preemptive.
Okay. Let's see the answer. So that's the right answer. Now comes the audience round. So a very complex question for the audience. Okay. Let us have the question. Yes, can we have the question? Arrange the layers of retina from inside to outside. Okay, this is for anatomy as well as histology. Physiology. So keep arranging the layers of retina from inside to outside.
Inner के बाद external of the rest of the
We also have 1 minute time.
Ophthalmology, same question itself. Jnmc student. 23 batch. What is your answer? Start, you must start.
What is your none? You can try. You can try.
Seven.
Seven. Inner limiting separate. Okay. गलत जवाब. Anything else? Which one is the first layer from inside out you are talking? First layer. All of you can take one attempt for the first layer. Different. Inner limiting membrane you said is the first one. That's wrong. Anybody else who should I show the answer? Fiber. Yes. Layer of rods and cones. Right. Outer nuclear. Outer nuclear layer. Okay. Now I show you which
External limiting, internal limiting, it
what is limiting? Yes. Okay. So let me keep trying later. I will show you the answer. Okay, let us have the answer. So it's the pigmented layer of rods and cones. Then you have the external limiting layer, outer nuclear layer, outer plexiform, inner nuclear, inner plexiform, ganglionic cell, layer of optic nerve fiber, and then the inner limiting layer. Okay, so these are the layers in sequence. Next, so let's have the next round. Round 6. This is a crossword round. Now let us have the rules for it. Please try. You people have to listen carefully. The questions. There are a total of 2 crosswords. So we'll be giving you papers. Okay. There will be 2 crosswords. First crossword consists of 10 responses, carrying a total of 100 marks. So you will have 10 marks for each response. And second crossword consists of 4 responses and it carries a total of 40 marks. Again, 10 marks for each response. Now, each team has a total of 6 minutes to solve both the crosswords. Okay, participants will be provided answer sheets. They are supposed to strictly write their answer to the crossword space which is provided in the answer sheet. Okay, you have 4 minutes to solve the first crossword, after which the crossword sheets will be collected, and 2 minutes to solve the next crossword, and after that the crossword sheet will again be collected. There is no negative marking, so you can attempt as many responses as you want. And each response, as I told you, carries 10 marks. So 4 minutes you need to submit your first crossword. Okay? We'll display the crossword for the audience. No prompting, please. Side. Okay, take the slides and calculations side. 5 acts against the virus. 6 increases in response to allergens. Then 8 is immunity against one's own cells. 9 is macrophages in the wound. 10 substances that can stimulate the immune response in the body. Okay. Down we have 4 clues. 1 natural immunity. 2 decreased number of lymphocytes. 3 produce response to antigenic stimulation. And 7 they are cytokines which are produced by lymphocytes. Okay? Your mind you can keep solving this problem. Okay. So 2 more minutes left. We've finished 2 minutes. So you need to submit your crosswords. And the next crossword you have to complete another 2 minutes. So the time has already started. Okay, you can start attempting that. Now, someone has submitted without name. So please write down your name in that. Yes. Now the second crossword across, we have 2 hits. This hypothalamic nucleus is the main nucleus for the main circadian rhythm in the body. And 3 is, this is the basic spinal reflex of posture. Down. Number 2, rebound phenomenon is one of the signs of its dysfunction, And number four, an involuntary movement caused due to lesion of the caudate radius. So after the movement, you have just 1 minute left. Submit your papers. Send your names. The team names. So can we have the answers now? You have to cross check your answers, right? So, cytoconjugation of T lymphocytes primers acts against viruses, interferon, increases the response to allergens, eosinophils, immunity against all one cells, autoimmunity, macrophages of both osteoclasts, substances that can stimulate immune responses in the body, antigen. Okay, and now we have natural immunity, it's innate, increased number of lymphocytes in lymphopenia, produce in response to antigenic stimulation antibody and cytokines produced by lymphocytes were inhibited. Okay, so these were the answers for the first cross-check. Now let's have the answers for the second one. I will please name it. So across is cytoplasmic nucleus, nucleus for the anatomy cytocircadian rhythm in the body, supraoptic, and basic spinal reflex for posterior specific legs. Right? Rebound phenomenon is one of the dysfunction. It is cerebellum and inequality movement caused the lesion of the caudate place was correlated. Okay, right. So we'll meet after the short break with the next one. Yeah. Up till the previous round are very important at this moment because based on the scores of this round, we are having the next round. Okay, I'll explain you how. So we have these. Let me read out the total. Addison 95, Bernard 175, Fazal 155, Gallen 135, Alvin 150, and Swan 145. Okay, so based on this, Bernard, I can see, right, is leading right now. Okay, so big round of applause for them. Okay, now can we have the rules for the next round? So our next round is the mixed background. Okay, so this is a mixed background where the team which has scored the highest gets the first chance to select the topic of their interest. Okay, there will be six categories of teams, and the winner team up till now will have the opportunity to select the first team. So this now includes a total of six teams or categories. Each category has one question to be answered which carries 20 marks. The team with highest score. Okay, so our team Bernard will get the first chance. Will get the first chance to choose their category, followed by subsequent. Our team Bernard will get the first chance. Will get the first chance to choose their category, followed by subsequent teams according to the leaderboard. Okay, so we will announce it early, and then the question must be answered within 1 minute again. Negative marking is applicable. So if you answer it wrong, there will be -5, and there will be no passing of the question again. Okay, so can we have the now the first question goes to Werner, team Werner. So team Werner, you can select any one of these and you will have the question accordingly. Okay, so they have opted for reproductive and endocrine or endocrinology. Can we have the question? Wrong, we get -1. Okay, it's a negative marking. Last awareness level, 30 seconds. What?
Is it carbohydrate deficiency of vitamin D?
So your answer was sarcophagus carbon deficiency of vitamin D. Okay. Your answer was chromosomes and parathyroid hormone deficiency. So with -5 for this. Okay. Right. Now next team Sajal. Okay. Did you get the next chance? So this will be eliminated. Reproductive is also offer that. Any other system offer your fine.
Neurophysiology or specific?
Okay. Neurophysiology or special sensitivity. Can we have the question, please? Okay. A 40-year-old man employed as a road construction worker for nearly 20 years. 20 years citizens report that he recently began to notice difficulty hearing during normal conversations. A Weber test showed that sound from a vibrating tuning fork was localized to the right ear. A Swabbat test showed that bone conduction was below normal, and a Rayleigh test showed that both air and bone conduction were normal, but air conduction lasted longer than bone conduction. So, what would be the diagnosis? A. Sensorineural hearing loss in both the ears. B. Conduction deafness in the right ear. C. Sensorineural deafness in the right ear, and D. Sensorineural deafness in the left ear. 30 seconds. Remember you are negative marking if you answer it wrong. Okay? Option B. Option B. Sensory neural deafness is the less located. Let us see the answer. So that's the right answer. Very good. This was a complex question, but they have answered it correctly. Very good. Next. So they get 20 marks for this. Now, two options are on reproductive and neurophysiology. So team Harley gets the next one. Respiratory physiology. Respiratory physiology. Right. Okay. So you need to identify the type of lung disease. These are the cases, okay, case 1 and case 2 with the given clarity. Okay, 10 marks each. FVC is decreased in case 1, FEV1 is decreased. FEV1 by FVC ratio is 40% of the normal value. And in case 2, FVC is decreased, FEV1 is normal, and FVC by FVC ratio is 90% of the normal value. So you need to identify the type of. First is obstructive, and second is restrictive. So that's the right answer. Is it? So the answer. First is obstructive lung disease, example it could be asthma, or restrictive lung disease, example it could be. That's the right answer. 20 marks for team Harley. Now, next, team Swan. You could choose out of cardiovascular, renal, or gastrointestinal.
Ma'am, renal physiology.
Renal physiology, okay. So let's have a question. Right. So this is the renal scramble. You need to unscramble this. And the tips are provided. This is the most accepted renal function test in the GFR. And the second one is these are one of the components of tests that are happening.
And the first one is inhibition clearance test, and the second one is macular denser cells.
That's the right answer. Now, next is Team Gallant. So, cardiovascular or yes, cardiovascular. So, arrange the following parts of conduction system in descending order based on their conduction velocity. Epinode, atrial muscle, Purkinje fibers, or ventricular muscle. Based on conduction velocity.
Fastest is Purkinje fibers, followed by SNO, followed by ventricular muscle, and then atrial muscle.
That's the wrong answer. Our faculty wants to answer. We never answer the faculty. So, ma'am, they have come all the way from Amravati school. And he is our ex-faculty. So, yes. Dr. Swapnil Hirangi. Right. So, the answer is Sukale, gastric and intestinal phases of gastric. So, these were the